You're watching Coronavirus in Context. I'm Dr. John Whyte, Chief Medical Officer at WebMD. Even before COVID-19, technology was playing a key role in the innovation of healthcare. Now more than ever, mobile devices are playing a significant role in how patients receive care and how they interact with their physician and the healthcare community. To provide insights about this transformation of healthcare, I've asked Taher Behbehani, who's the General Manager and Head of Mobility B2B at Samsung Electronics America. Taher, thanks for joining me.
Thanks for having me.
Taher, I wanted to start right off with asking you, what's the role of mobility and 5G in transforming healthcare, especially now during this pandemic?
It's quite critical. So think of 5G as a very fast pipe, as a very big pipe, as a very long pipe, and a secure pipe.
Okay.
Which means that you can have access to information at any place in a very effective manner.
Mm-hmm.
So you can take a patient, the information, review it on a mobile device, very high quality, make diagnostic decisions. You can review x-rays, you can review basically data and images that you otherwise would have to see a patient face to face. In this day and age, what we have managed to do is we created these kits, these basically packages for healthcare, and which means that the user gets these kits delivered to their home. They open it up, the device is set up, and you can actually log on and see and connect to your physician, connect to your doctor, hopefully prior to any situation arises or after for monitoring and care.
But these are also touchless, are they not?
That's right. Many of these devices, these phones are very designed with a very interesting UX. You can actually, once you unbox them, you can use voice recognition to activate. Some of these have a new user interface. We are now seeing cases of avatars being used quite a bit, actually. So if you're not in the mood to type in, you can actually have someone speak with you. And it's AI based, so you can actually we're working with companies that have designed these that makes it very interactive and quite engaging, and can navigate and guide the discussion to where the information is most appropriate.
We've been spending a lot of time talking to experts about the role of telemedicine and telehealth. And we talked to the folks at Kaiser Permanente who had said 80% of visits right now are telemedicine. We don't expect that 6 months from now, but it's not going to be 2% or 5% as it was in some other areas. And then we also have remote patient monitoring, which was starting to build some strength prior to COVID-19. How do you think telehealth, telemedicine, and remote patient monitoring are going to look post-COVID?
Prior to this situation, telemedicine, telehealth was there as what I would call a niche offer. After the COVID situation, it turned out that because the solutions existed, the packages were designed, there was no R&D needed. We put all of this together, repurposed them with our partners, specifically for telemedicine, remote monitoring in the current situation. I think the user behavior will change. Just like you and I are using this new technology, this new medium, I think that we will get used to, and both sides, both the physicians and the patients, will get used to interacting in this manner. Now, if you have the accessories where you can actually send your vital information back to using data and data networking, 5G, back to the doctor, you don't actually have to go in person if they have the information that they would otherwise be getting it physically in the office. I think this is now at a phase where will be adopted more readily. We are going to keep it as a routine part of our health management going forward. Will it be 80%? Don't know, but it would be higher than what it was a few months ago for sure. There's no question about it.
Do you think the issue with adoption was more about the regulatory hurdles that companies and physicians had to do to provide these services? Or was it more of the adoption from consumers and patients that felt uncomfortable? I've heard patients say they don't trust, the devices, or they don't want to be recorded. You mentioned about some privacy issues early on. What do you think was the big issue with adoption pre-COVID?
I think the issue was mostly behavioral. I think basically it's the established habits that we have had. It's not easy for patients nor doctors to learn and change their routine. And I think this forced this upon us. There was no other option. And once we tried it, we said, "Oh, actually, interesting, it works." So I think it's mostly like adoption. The adoption curve, which would have taken, let's say, 10 years or 5 years or 3 years, became 6 weeks, and here we are. So I think that's really key. I think it's less regulation, more adoption.
Okay. And digital really has stepped up to the plate when we think about addressing the challenges that COVID has imposed. And I read this very interesting article that I want to ask you about in Bloomberg that talked about Ford tests these buzzing wristbands to keep workers at safe distances. So we're all talking about this physical distancing. So I want to hear about how you all came up with this idea that you're going to have a wristband that buzzes and maybe turns a different color when you get too close to people. But that sounds pretty interesting.
Yeah, actually, that's right. It's one of these things.
Right?
It's really nice. It looks good, feels good, and I use it on every day.
Tells the
So,
time too, right?
of course, time. It tells you a whole bunch. How many steps, what you do, how active you are.
Right.
It's quite intelligent. Look, on this particular application, it turns out that watches, especially this design, it has a Bluetooth technology which is low power. So you wear it using very sophisticated software that's easily downloadable to devices. You can measure the distance pretty accurately with the other person or people around you, and the device buzzes you and gives you a sensation. It doesn't embarrass you, no alarm goes off, but it gently buzzes you so that you know if there's a vibration that, wait a minute, maybe I should step away.
Yeah.
That's number one. Number two, you don't need any new infrastructure, no new wiring, nothing that you have to put on a wall, no cables that have to be run. So you essentially don't touch the work environment from an infrastructure point of view. That's pretty good. Number three, we tested this with our partners and realized it does, in fact, the rate of interaction and proximity, let's say, issues that come up drop by about 50%. So people do learn by feedback mechanism. Right. The ease of use was ingenious from Ford UAW to sort of realize that this type of device, and by the way, you wear it all the time, and you can enable it by our software so that it's activated at your work, not outside, but at your work. Out of the work environment, it's the function disabled. So these things make it very easy for a work environment, and that's how we discovered. The one thing I want to tell you about these smart watches, this is a Galaxy watch, and our devices, these are computers, very powerful computing devices. So we can load a software on it. If we need to change, modify, enhance, or add new features to it, we can do that. Yeah. So that's what makes it very interesting and I think useful, especially given that I always tell people we need to be very humble in this situation. We don't actually know where this is all ending up. We know how to manage it, but exactly how things will pan out specifically from a technical point of view, we don't know. But these are very good platforms to sort of adapt to whatever comes up.
Take out your crystal ball. Tell us what the physician-patient interaction looks like 5 years from now.
I was a biomedical engineer, and I started my career actually working in hospitals. And crystal balls are very interesting. Some things haven't actually happened, which we expected to happen. I think.
What did you predict would happen that you expected?
Oh, but we expected a lot of things happening. Sort of remote monitoring, okay. AI, remote diagnostics, right. Which some of it did, but slower pace. Things take time.
But 5 years from now, is it going to be all DIY? Is it all going to be they're talking to an AI device? What's it going to look like?
I think from a health point of view. This is my personal view. One is that we're going to be much more, health is going to become much more similar to fitness. We'll give our data. We'll be okay with giving our data. In return, we need to get some diagnostics out of it. Number two, I think the information, basically based on algorithms. AI is a kind of interesting term. Machine learning, algorithms, intelligence, sort of feedback mechanisms, I think, connected to us for us on a personal basis. So will become much more important. Sharing that information with third parties in a protected manner is very important. There are mechanisms to do that. Imagine putting this in a lockbox and releasing it only when needed. I think physicians will become a lot more tech savvy. I will go to my doctor. My doctor will now come with a stethoscope, but also a push to talk device, a body cam that actually sees me, records it, and has that interaction with me using technology as well. So I think you'll see a lot more of that happening too. And I think before 5 years, actually, before 5 years is out, this will probably take place.
Well, maybe we will visit you in a year and see how we're doing. Taher, I want to thank you for taking time to spend with us.
Thank you so much for having me.
And I want to thank you for watching Coronavirus in Context.